Dr. Benjamin Domb here at the American Hip Institute, here with Dr. Walid Elnahal, who is here with us at the American Hip Institute as part of the ISHA Traveling Fellowship, and is here from Egypt.
Thank you, Dr. Domb, and thank you to Dr. Domb, the team, and ISHA. Had a great week here at the American Hip Institute, and got to observe Dr. Domb with various techniques, and also in the outpatient department. Very lovely team, very welcoming.
I was wondering if you could tell whoever is watching a little bit about the ISHA Traveling Fellowship.
Yeah, so basically I think you have to have an established hip arthroscopy practice for a couple of years, have to be an ISHA membership with all that it entails and the requirements of the ISHA membership. And then you apply for it.
And a huge congratulations to you on being awarded the fellowship. ISHA is obviously the International Hip Preservation Society. You have an interest in hip preservation being your specialty in Egypt, and your application was chosen from amongst many surgeons who had applied for this fellowship in order to come here and to a couple other centers to learn more about hip preservation. So tell us a little bit more about how this is going to fit into your career and how it's going to make a difference for both your career and for the orthopedic field in Egypt, in your home country.
So a couple of things. First, about my career. So in Egypt, hip arthroscopy has been there for about 5-6 years, maybe a bit more. But it's not well established as other sort of places, whether in Europe or in the US. So when you are starting to set up a practice, there are a lot of challenges, both in the clinical aspects of, because you don't have the support of a large group of surgeons or MDTs as you would have elsewhere, and also lack of general knowledge of the orthopedic community into what hip preservation is and what it entails. And I think how the fellowship really plays a role here is that it gives someone who is still starting to set up a practice, starting to sort of hasn't really put his mind into what techniques he should use or how he should approach certain pathologies, into observing the pioneers of that field and picking up how they deal or how they approach certain pathologies, what their philosophy is about these certain pathologies, and their surgical techniques. Some of these techniques, I understand, might not be applicable straight away, but then you have something to work towards.
Obviously, our mission at American Hip Institute is to help people get their lives back, not just by the patients that we treat here, but also through research and education, and having the opportunity to help with your education and help forward your career. I hope will help many patients in Egypt who otherwise might not have been helped. What are some, excuse me, what are some perhaps examples of things that you might take in terms of the surgeries themselves and the clinical practice that you might take from what you have learned here at American Hip Institute and in general as part of the ISHA Traveling Fellowship that are going to enable you to do things for patients in Egypt that currently no one there is able to do? What are some surgical techniques or medical things you've observed?
I think so. Number one is the capsule, and I think what I would probably need to change. First thing I go back is I need to respect the capsule more. Number two, knowing the sort of different options that you have when addressing labral pathologies. So whether it's the repair or the augmentation or the reconstruction. Number three really is dealing with the peripheral compartment or the CAM. So using hip check seems to be sort of the way forward, really.
Right, absolutely. Yeah. And we have this concept called pay it forward. Have you heard that expression
Definitely,
before? So with respect to education, I know that at the beginning of my career, I had wonderful mentors who really helped me, and I've tried to pay it forward by likewise, being a great mentor to fellows that we educate, to you being here at American Hip Institute as part of the ISHA Traveling Fellowship. Do you imagine you'll have an opportunity to pay it forward yourself in Egypt? Will you have an opportunity to
definitely
teach other surgeons there?
Definitely. So in my setting, I work in the university hospital, Cairo University, so we always have trainees there. In my practice, I get a lot of visitors also coming to see my practice, and we try to organize a hip arthroscopy course once a year. We managed to do it last year. And we are planning on doing it this fall as well. And we get candidates from Egypt and from the neighboring countries around us, all interested in learning hip arthroscopy.
So that makes the ISHA Traveling Fellowship's impact pretty far-reaching potentially. If it helps you treat 1,000 patients, but also helps you teach 100 other surgeons, and each of them treat 1,000 patients. Now that's 100,000 patients who are helped better. Thanks to the ISHA Traveling Fellowship. So it's a wonderful thing. And again, a huge congratulations to you. Well, listen, it's been a real pleasure to have you here, and I look forward to you doing great things in your career and to following your career from here.